Hello, I'm Dr. Oyan Hodhurai. I'm a dentist at Apollo Dental Astra. I am an endodontist, a certified laser dentist and a forensic odontologist. And today I just wanted to talk to you about root canals and endodontic treatment, how we say it scientifically. So I just want to clarify a few misconceptions some people have. Endodontic treatment or root canal treatment, there is no age for it. A young kid can also have it and an old person can also have it, right? And another thing that I wanted to say is, like, root canal, any tooth which is infected with caries or a cavity has formed, it's not necessary that every tooth has to be removed or an implant has to be placed, because at the end of it, something given by God there's no replacement to it. So there's no replacement to natural teeth is what I mean to say. So what do I mean by endodontic treatment or root canal, and when does it happen? At what stage does it happen? So just to explain to you that this is a tooth, this is there in 32 teeth in a person, and a teeth has 3 layers. The outermost is the enamel, the middle layer is the dentine, and the innermost is something called the pulp, which has the blood vessels and nerves. So an infection, when you have a cavity or an infection, when it is at this stage, it is still fine. It can go ahead with a filling. Even when it goes deep, it can be done with a filling. However, when it involves the innermost part, which is the blood vessels and the nerves, which gets irritated, and that's why you have pain, that is when a root canal is required. So what is a root canal? Firstly, this is the infection. As I mentioned, this is a small infection. This can be filled. However, since this infection has involved the innermost part, which is the blood vessels, this requires a root canal treatment. So the first step is the opening. This infection is removed and the full pulp tissue is accessed. This is called access opening. Then we go ahead and remove the blood vessels and the nerves which is infected or dead, which is the reason for pain. Once that is nicely cleaned, we go ahead with the filling of the tooth, properly 3-dimensional fill of the tooth, and then we go ahead with the permanent filling and a cap. Now, in cases you might have a question, if the tooth is too far destroyed or a lot of the tooth structure is gone, even then it can be salvaged by something called a small pin. A small pin is attached so that the filling stays and the whole tooth has a good condition. And then we go ahead with the crown, because a root canal treated tooth, the strength of which is a little reduced and there is chances of fracture. That is why we want to reinforce that tooth with something called a crown. Now, if there is some fracture or excessive gum disease, or the infection is too big, or certain cases where a root canal is definitely not possible, an endodontist will be the first person to say remove the tooth and go ahead with an implant. Aside from this, because this is a conventional treatment, a root canal can be enhanced. There is lasers in our Apollo as well, and those lasers have, aside from the conventional treatment, the lasers can help to benefit it, and basically the efficacy of the treatment improves, your pain reduces, and the healing rates are much better, and the infection can heal. Aside from that, there is ultrasonics, there's loops, so there's n number of advancements to make sure that your root canal goes as seamless as possible. And of course, the most important thing, do root canals pain? For any procedure, we go ahead with giving an anesthesia, a strong anesthesia which will numb that entire area. It will last for 3 to 4 hours. But the idea of the injection or the injection is to numb that down and to make sure that you have no problem during the procedure. So it can be as painless as possible.